everybody. Thank you so much for joining us today. We have a really special guest. Her name is Dr. Mirkal, and she is the person who runs and operates the Prime Integrative Dental Clinic out of Dallas, Texas, that area. I really appreciate you being with us today. And what really got you into the whole? Tell us a little about yourself and what really got you into the whole biological holistic dental side.
Yeah, thank you, Toby, for having me today. So, I actually started practicing. I graduated from dance school here in 2012, but I was a dentist back home in India, and I was practicing there as well.
Okay.
So when I came here, I started practicing. Within the first few months, I think 6 months to a year's time, there was a moment where I would ask myself, is this what I'm going to do like for the rest of my life? It was like it kind of didn't make sense, but I didn't have a sense of direction. But then I was having a lot of health issues, and so was my daughter. She was like a year old then, so she would have a lot of ear infections, and I would have a lot of issues from childbirth and stuff like that. So, and I would always see my conventional doctor. They would always prescribe pain medication, antibiotics. So it was always the same thing. Kind of didn't make sense, and it was like there has to be more to it. So I started looking at other alternatives for myself and for my daughter. The starting point for me to look into alternative therapy. So she would get a lot of ear infections. So I was trying to see what we could do from that standpoint. And then through my own personal lifestyle changes, I stumbled into holistic dentistry. And when I think I was temping for someone, and I was introduced to holistic dentistry. It made total sense because for once my lifestyle was matching to what I wanted to do in dentistry. It was like, okay, nobody ever speaks about this thing. Maybe I was under a rock or something. Like, where is this coming from? So I worked there for a very short duration of time. But by the end of few weeks, it was clear in my mind that this is what I want to do for the rest of my life.
Okay.
I changed my practice philosophy. I was still an associate. I didn't have a practice, but I started doing everything to learn about holistic dentistry because it just made total sense. There's not another way for me to explain it because it just like sometimes when you know things like is the right thing, it was not easy.
Yeah.
Yeah, that's probably how I got into it.
Well, and that makes a lot of sense because just I get to deal with a lot of like other holistic dentists and just learning more about what's going on. I mean, overall, from what I'm seeing is, there's a lot of people out there who have a phobia of going to the dentist, and the biological holistic approach offers a much more minimally invasive option for people. And, they're willing to take a second look and willing to say, hey, we can make some of these changes and potentially we can hopefully save, from this additional work, because there's that whole connection that's out there that's really getting popular. It's that full body health connection. And so
100%.
our teeth, dictate what, like if we have healthy teeth, chances are we're going to be okay over here. But if we're not okay up over here, maybe something's going on up here. And so it's really accelerating. And I think if you're not actively looking to add holistic or biological approaches, you, as a dentist, you are not going to be on the cutting edge. You're not going to be receiving more clients, and potentially, you could be suffering. It could cause your business to suffer as well. And that's just my personal opinion.
Yeah, no, I agree totally. And there's no doubt in my mind at this point of time. Like I've been doing holistic dentistry for some time, but initially when I was introduced to holistic dentistry, I was totally sold on mercury because it made total sense. Like when you're placing mercury in someone's mouth, and then all this mercury that gets left out, that that gets disposed as a biohazard. So it didn't make sense putting somebody's. Then now that is getting, we need to take precautions and things like that. So, but when it comes to root canal and stuff like that, I still had no idea. But I was open. I was
Yeah.
open to learn. And when my patients would come in and they would say, just take this root canal treated tooth out for me. And then I would take it out and I would ask them, okay, so what changes are you seeing since I took this tooth out? Because for me, it was very important to understand these people are saying that if I go in and take out this tooth out, other things are going to go away. So I just kept an open mind and they would tell me all these things that they no longer had that they were experiencing in the past. And that was far more, educational for me because you don't learn these things in school. You go to courses and stuff, but it was like hands-on very.
So it sounds like, from what you're mentioning, you're removing root canals, from people who have had them done. Just from what I've learned about root canals, root canals obviously, get done probably hundreds of thousands of times a year on, people all over, probably even more than that. Have you ever like operated on a root canal that did not have like bacteria? Have you ever seen good root canals? Like what's your experience? Because like a lot of the dentists that I've talked to, they're always seeing some type of bacterial infection in these because you're essentially killing off the blood supply to the tooth. You're killing off the blood supply, the nerve endings, and so how is it going to keep itself like sterile essentially?
So very good question. So what happens is like when you look at a tooth, so the tooth has the enamel and the dentin, which are the two almost like shells. The central part of the tooth houses the blood supply, nerve supply, lymphatic drainage. So in that sense, your tooth is just like your kidney, liver, gallbladder, right? Any other organ has blood supply, lymphatic drainage. But the principles of medicine don't seem to apply that to dentistry, right? So say for instance, you have uncontrolled diabetes and a diabetic foot. Your doctor is going to say, we need to cut that foot because that gangrene is going to spread to the rest of your body, right? If appendicitis, they cannot control it with antibiotics. They say we need to cut it because, you can't be on antibiotics for the rest of your life. But when it comes to dentistry, when the living portion of the tooth is compromised, we say you need to do a root canal. In my opinion, it's a flawed philosophy because when you no longer clean out that central part and fill it with the inert material, you still leave room for low-grade chronic inflammation because the second layer of the tooth, which is the dentin, is almost like a sponge, right? So it's like a conduit. It's supplying nutrients and then it's up waste material. So all this organic material that's stored in there, which no longer is receiving blood supply because of the root canal, now becomes the breeding ground for anaerobic bacteria that does not need oxygen to thrive. So over a period of time, it starts producing these toxins from those anaerobic bugs that triggers your immune system. So your immune system goes on high alert and it's now producing the storm of T cells, to fight this infection in that tooth. But it does not have access to that tooth because your blood supply is cut off, right? So now the storm of T cells is going to produce collateral damage in your body in the form of inflammation. So arthritis, fibromyalgia, you name it. There's so many, all chronic oxidative stress should always first be looked at. Is there a dental to this? It's very interesting. So it's where they looked at people with 4 more root canal treated teeth and looked at their Rantis score, which is your T cell activation of T cell score, which is again associated with your overall how is your body dealing with your immune health in general, and that score goes up.
No, that's really fascinating. I mean, I think there are so many people nowadays who have chronic health issues that are probably completely unaware what could be causing it. And that does that really ties in, to like if somebody doesn't want to get a root canal, I guess the option is an implant. And so, there's a lot of controversy around implants as well. Like the two types of, most people are going to get titanium implants. There is another more biocompatible option called zirconia implants. I think, from my understanding, it's only like 5 to 10% of all implants done are done with zirconia implants. Like, what's your opinion on the whole implant thing, and what would you have to say about that?
Sure. Before I talk about implants, I'd like to say on an average, I get at least 4 to 5 consultations a week, just a second, third opinion, because a tooth has been diagnosed, has been told that it needs a root canal. A lot of the times, root canals are highly overdiagnosed because in conventional dentistry, we really don't know what else to do, right?
Yeah.
A lot of the times we go in, most holistic practitioners, we look at the tooth. If there's deep decay, we clean it out. If there's no inflammation or infection around the root portion of the tooth, we work with ozone because it kills a virus, fungi, parasite. It sterilizes the tooth. It mineralizes the remaining tooth structure. And then we restore the tooth if it needs a filling, we place it. We do some ozone at the tips of the tooth. So and we, in some instances, if the cavity was really deep, then we have them come in for ozone injections for a few weeks, just to kind of give some, TLC to that tooth. And in most instances, that tooth does not need a root canal because we are able to resuscitate and increase the blood supply back to that tooth. So if you provide the body with elements needed for healing, it has the ability to heal itself. So
you're generating a healing response utilizing ozone, and which is amazing because like that's something that a lot of people don't want to do. I mean, that's a major. I mean, I think with a root canal, I've never had one, but I mean, I'm guessing they put you under to do that. So, I mean, it's a pretty major thing. But I know, but there are circumstances where you like if the tooth is too far gone, obviously something has to be done. So.
Obviously, if someone comes with an abscess tooth, obviously it's a dead tooth. You cannot put life back in a dead tooth. So at that point of time, it becomes our duty as dentists to give everybody, every consumer the options. So they have all options, including doing. So we give them all the options. And one of the ways we treat in our office is we take out the tooth, we clean out all that infection, low-grade inflammation, clean out all the ligaments. We use laser, we use PRF, we draw the blood, we spin it, and we use growth factors from your blood because that's like instant healing for the socket. So the body instantly recognizes it. So it expedites the healing. We do ozone homeopathics. We do a lot of homeopathics too, infrared, and we do use ceramic implants. So initially, when I was doing this work, I was really skeptical about whether to do implants or not, because at the end of the day, implants are foreign objects, right?
Yeah, they are.
In a human body. So what response will that have on our immune system was one of the questions in my mind. So Dr. Klingenhardt did a study where he looked at people who took their root canal treated tooth out on one side and left it the way it is. And on the other side, he replaced them with ceramic implants. So the energetic flow back to that site seemed to improve where you place the implant. And the reason why that happened was when you take out a tooth, your body is so intuitive, it already knows that you don't need so much of energy flowing back to that side because there's a missing tooth, there's not enough function. So let's conserve that energy elsewhere. So your energetic flow drops when you take out teeth. And that's a part of aging, right? As we age, our energy drops. So same thing happens with when you have a missing tooth. But when you replace it with a non-metal implant, because it's a non-metal, it's non-conducting, then your energy goes back closer to normal. Not normal, but closer to normal. So if you will see 50, it'll be closer to 30. So it's been done a few times. After seeing that work, I am comfortable recommending ceramic implants to my patients.
No, I've seen really interesting like slides where they show. Like I saw a slide where somebody somebody had like a titanium implant in their toe, and they had a titanium implant in the mouth, and they could actually measure conduct like actual electricity from the 2 points. I mean, if you think about like, it's almost like putting a battery in your head, and that's got to throw you off at some point. Another mention, like I was talking to another dentist, and he mentioned that he removed a lot of titanium implants, and he claimed that like every single titanium implant that was removed, he noticed some type of necrotic tissue developing on it because, you know, it's just not a natural part of your body, and so they're gonna cause issues down the road regardless.
Yes. So what happens with metal implants is all metals in dentistry are alloys. What that means is two or more different metals sitting in a solid like your saliva or blood will create a low level of current. So it creates like a battery effect. So human cells have a certain amount of charge, very low, like 0.00 something. It's a very low amount of charge that ensures integrity of your cell. But when you have a disturbing energetic field created by a metal alloy, um, almost like a battery effect, it throws off the electrical balance of your body and other cells. So a lot of the times people have symptoms that are coming from the battery effect and they don't realize it's because of that. Most common symptoms are ringing in ears, seeing floaters, brain fog, body being more predisposed to co-infections. I've on my website, if you see, I've written a few blogs, which is very extensive. It talks about the battery effect. It talks about metal implants and the immune response and things like that. So it definitely, if anybody does choose to do implants, then they should always opt for non-metal.
Yeah, I know. I think that's 100%. I mean, just the things that I've seen, you know, getting to listen to a lot of these dental offices speak, you know, this is a long-term, putting an implant in is a long-term thing. You know,
Yes.
you don't want to keep removing these over time. Like, do it the right way the first time. I mean, yes, you're going to spend probably a little bit more money using a ceramic implant, but it's going to cost you potentially a lot less money in the long run, and you're going to feel substantially better, you know, as far as your overall health. I mean, to me, it's a no-brainer. I mean, I wish everybody would think that way. I think, you know, sometimes you have to do it the right way the first time, and that's going to overall be better for the human body.
Yeah, so many people come in being like they're so sick, they've been diagnosed with something, and then you look at their x-rays, they have like 4 or 5 root canals with lesions sitting on those root canal treated teeth, and then implants, and then they're eating right. Like, where is this inflammation coming from? It's a question we need to ask.
Yeah. No, seriously. I mean, I think everybody has chronic low-grade inflammation, and it's going to contribute to a lot of other diseases later on in life. You know, you're going to not feel as energized. I mean, you've got to get that low-grade inflammation under control if you're going to not get sick and feel substantially better. No, I completely agree. So like, it sounds like you obviously use a lot of ozone in your clinic. Like, what's your response from patients like that when you start asking about ozone, and as far as like, do they say why would you use ozone? Like, what are you seeing from patients when you start saying that?
You know, in that sense, I've been so blessed because my entire practice, when I had the vision of my office, I wanted to start a holistic practice where people are coming because they have already done their homework. So I would say 90% of my patients already know about these things. They've done their research. So thankfully, I don't have to explain. But the other 10% who come, I do tell them about ozone. We have a lot of material in our office. We refer them to IAOMT website.
Yeah.
They have extensive information. They have a lot of factual scientific data so that, you know, if you're still skeptical on the fence, you don't know, is this quackery? Because a lot of time holistic dentistry is viewed as, you know, quackery and, you know, voodoo and all this stuff. Go to the science, read information. It's mind blowing because there's so many times, like just last week we had a patient. She had like this big canker sores in her mouth, and then she's got it's called as ANAG, acute necrotizing ulcerative gingivitis. It usually affects the lower front teeth. Like really deep severe ulcers. All we did is we treated it with ozone. We made her sit with high concentration ozone gas for 30 to 40 minutes. We got her back in few sessions, and that ulcer was completely zipped. It's mind blowing what this stuff does, and it's unfortunate. Like they should be mainstream.
No, I agree. And I do want to note for any skeptics out there, go to Colgate's website. They have a whole section on ozone in dentistry that they've done several articles on. So, if Colgate, mainstream, toothpaste seller, whatever they do, if they're actually talking positive about ozone, there's probably something to it. And I think that's a big deal that they have actually put that information out there. Let's go over a little bit how ozone actually works in dentistry. So ozone is obviously a really powerful oxidizer. All it is oxygen, so it's basically supercharged oxygen that is converted to O3. And so I know it's negatively charged, so when it enters like the mouth or when you inject it into a specific area, what is it doing? Like how is it operating? Like what are we seeing from ozone when we do that stuff?
So basically, as you already know, a lot of the stuff, ozone has got several applications, and in dentistry, the way we use ozone is we use it to insufflate in the gums. We use it on the surface of teeth, which has really deep cavity. So after we clean out everything, we put high concentration ozone gas. So the basis of ozone action is because it has got an extra electron. It is highly negative. So anything negative will actively seek positive. So I tell my in simple words, ozone is like a Pac-Man. It actively seeks infection. All infection are positively charged. Your bacteria, fungi, virus, parasites are all have a positive charge, and ozone will seek that. Okay, so the way it works is the moment it delivers its charge, it creates a few more, what do you say, surplus elements like your hypochlorous acid and few other by which in turn also sterilizes the tooth. So it activates your mitochondria. We all know what that does. The powerhouse of the cell. So it activates the mitochondria, it produces hypochlorous acid. It will selectively kill bacteria, virus, fungi, parasite. Now, if you were to compare the action of ozone to that of a chemotherapeutic agent, like chemo that's used to kill cancer cell, it is non-selective. It'll kill everything, right? And that's many side effects. But ozone will only kill, bugs, because bugs do not have cell wall protection in the form of antioxidants. Human cell wall protection, and that's why ozone will not have detrimental effect on human cell. If anything, it'll positively reinforce the action of mitochondria. So that was a lot of, I think, about cell and stuff. But in dentistry, what I see is they have less sensitivity. They have it increases it kind of jump starts the tooth, in simple words, because if I'm sterilizing that tooth with ozone, that person is going to have less pain, less sensitivity. The chances of low-grade inflammation is reduced. So we see a lot of positive things. We also recommend oil pulling with ozonated oil. The only thing is it's so strong, like it tastes like chlorine. But there are newer products, like you guys have come up with amazing,
We've tried it. Like one thing about ozonated oils is they don't necessarily taste that great, but we have done a lot to improve the taste. And I mean, I have so many people, like we have so many great reviews on the oil pulling and all of our other ozone dental products. It really does work. I mean, if you can get past like some of our stronger products that don't taste as good, if you can get past the taste, like you're going to notice phenomenal results. Like it's just going to keep that anaerobic bacteria at bay and just hopefully help that mouth regenerate much faster.
Right, I agree. So we do like a challenge in our office as we tell our patients, like if you're committed to doing like a 1-month challenge where you can oil pull, and like we take pictures before 1 month and 1 month after, and it clearly shows at least 1 or 2 shade improvement. Like if you're able to oil pull, like from an aesthetic standpoint, okay, it's healthy.
Okay, yeah.
from an aesthetic standpoint, it'll make your teeth wider, like right off the bat.
Yeah. So like what's the mechanism, like oil pulling, like that's a great question that gets brought up a lot. Like what is the mechanism behind oil pulling? Is it pulling out? What is it actually doing in the mouth?
So basically, the way oil pulling works is because oil is heavier, denser, it has a more grip. So when you oil pull, you kind of physically pushing the oil underneath your gums, and it
Okay.
has more action. It pulls out more bacteria. It helps to the simplest way to explain is it's got a deeper reach than your mouthwash. Like
Okay.
if you rinse your mouth, if you use a mouthwash, and then you switch to oil pulling, you will definitely experience a cleaner mouth because it has a deeper reach. It grabs more. That's the simplest way to say it.
That's a really good explanation, honestly. That makes a lot of sense.
And the best part is you will see your teeth will be more wider if you have, like, whenever people tell me they have sensitivity, I tell them do oil pulling, and a lot of the time that takes care of it. There are other reasons why people have sensitive teeth, but this is like the easiest,
Yeah.
like, not like inexpensive way to address it, and it's good.
Yeah. No, that's cool. So what else, like, what's your thought? Like, obviously we're talking a lot about ozone, what's your thoughts on, because home ozone therapy is also taking off quite a bit as well. Like, what's your thoughts on like patients doing ozone at home, whether they're making their own ozonated water for mouthwash or, stuff like that?
So, I mean, if you know what you're doing, then that's great. I kind of am a little skeptical. Even though I was a provider myself, I was like, okay, I have kids at home. I don't want the tank to be knocked off because, it's oxygen at the end of the day. So there's a little amount of risk. So if you already know what you're doing, then that's fine. But it's okay to use, ozonated water for mouthwash. You just have careful how you place it because at the end of the day it's a oxygen tank and stuff like that. As far as ozonated oil is concerned, it is so messy. It is so messy to make ozonated oil. I would rather buy a small jar of ozonated oil, and it goes a long way. You buy a small jar, and it's so potent. You don't need a whole lot. So I would not recommend anyone making ozonated oil at home. But you if you wanted to do urine suppletion or other stuff,
and we've seen a lot of people who, like a lot of dental offices I work with, they do actively promote home ozone specifically for like if they have other underlying health conditions. Because the method of insufflations, whether that's ear insufflations, rectal insufflations, you can help fight some systemic infections that could be causing other issues in the body. And just like what you said, ozone is so negatively charged, it's going to attract itself to a lot of the bugs that could be also making you sick. So if for people who are wanting to get that oxygen tank and give it a try, I think it's a fun thing to do, but obviously know what you're doing beforehand, if that makes sense.
Yes, I agree.
No, this is really, really good information. I always like to, obviously being in the whole biological dental field, one of the big controversies that we typically run into is the whole use of fluoride and stuff like that. What's your thought process on fluoride in dentistry? It seems to I see people on different ends of the spectrum all the time. Some people are pro fluoride, some people are against it. If you have what's your opinion on it? We would love to find out.
So, in my opinion, fluoride is an industrial waste that's found its way in dentistry.
I don't think most people know that, honestly. So
basically, what does fluoride do? We need to understand, where they say that fluoride is having anti-caries activity or it's preventing decay. That's really not true. We all know, whenever there's, fluorosis, where excessive amount of fluoride is naturally present in water, people have so many conditions like molting, where their, enamel and tooth structure is compromised. And we treat this all day long. Doesn't matter, it's a holistic office, conventional office. You see this in dentistry. Um, there may be some, the way it works is it hardens the remaining tooth structure, but in the sense it is compromising, it's making it weak. So, like China, right? If you drop it, it's going to break into pieces. It's not strong, but it is hard. So there's a difference between strong and hard. So it does the same thing. It makes the exterior surface of the tooth extremely brittle. But again, that's not what we really want in our tooth structure. So a lot of the time, these fluorosis will actually create surfaces that are more prone to decay and breakdown. So it really, in my opinion, I don't see any anti-caries activities, but instead we recommend oil pulling, because what that is doing is it's bringing back the microflora to a more neutral one and addressing that. A lot of the times when there's water added to fluoride, like fluoridation, it has little to no effect in the mouth. So it really is, I mean, that's getting more political and stuff, but I don't see how that has any benefit to the water and to the teeth in general, because,
I would definitely agree, and I'm anti-fluoride. I have a fluoride water filter at home that takes it out. And from my knowledge, like there really has been no like long-term studies done that actually show any benefit of adding fluoride to the water. I think it's just this way of getting rid of industrial waste, just like you said previously. And it's like a convenient, easy way to do it. And unfortunately, when it provides no benefit, like that's, in my opinion, criminal. And so I think the best thing that we can do to help get fluoride out of our water is go talk to your city council. I mean, go discuss that with them, figure out who's adding it, why they're adding it, and show them, tell them to produce documentation that shows the benefit, and I'm going to bet they can't.
And I can tell you one thing, fluoride is the last thing that gets added to the water. Like when the city, releases the water, fluoride is the last thing. So it's the easiest thing to take off. In the state of Texas, in Dallas, they require 7 dentists to stand up and say, please don't add fluoride. So if they are listening to this.
Yeah, people, please get out there, talk to your city about getting this removed. It is a big deal. I mean, we don't need fluoride in the water, and there are municipalities around the country that have been removing it. There are unfortunately municipalities that are currently adding it. So there's no benefit. So talk to your city, see if you can get it out of the water supply. I did want to dive into a little bit. This is a question that gets brought up quite a bit. Is obviously the microbiome. We have a microbiome, in our bodies, but we also have we also have to have a microbiome in our mouth. If you don't mind discussing that, how can ozone affect your microbiome? What are you looking like? What do you recommend to people to keep that microbiome healthy and stuff like that?
Sure. So in our office, we have a microscope, a phase contrast microscope. So we take a plaque sample, we put it under microscope, and we look at the oral microflora. We usually, for the purpose of simplicity, we break it down into normal, healthy, mild, moderate, and severe risk. So any anaerobic bacteria, any parasites, spirochetes, any gliding rods, anything that has a lot of movement is all labeled under high risk. Anything that's that's a bacilli, these things that they don't have too much movement are more healthy. Okay, so there has to be a balance between the healthy and not healthy cells in the body. So we have seen that whenever there's a lot of, especially spirochetes, for that matter, a lot of high risk, but spirochetes especially, they will thrive in an area of low oxygenation and low oxygenation in general in the body.
Okay.
And whenever we go in and do ozone and take another slide sample and put it under the microscope, there's like zero spirochetes. So it will literally kill a lot of high risk and moderate risk bacteria. So definitely that. Sometimes when we see a lot of parasites and amoeba, white blood cells, those are indication where you know that there's a oral systemic connection, and you may need to dig deeper and see where is this coming from. Is this dental related, or is this coming from somewhere else? So for those things, when we see parasites and things like that, we encourage you to work with functional medicine provider and naturopath and things like that.
No, that's good. And like the question I get a lot is like some people mention, I mean, will ozone kill my good bacteria? Yeah. I mean, it's going to kill the bacteria, but if you already have like an underlying issue going on in your mouth, you have an overabundance of bad bacteria that needs to be brought under control. And so, the ozone is going to be there to essentially kill that bad bacteria. And from the people who have explained it to me, some of these medical doctors, the good bacteria will bounce back substantially faster than, whether if you're using like an antibiotic or something like that. So, it's all about balancing what's going on in your mouth. If you have an oversupply of bad bacteria, that has to be dealt with. So, or else you're not going to get better.
Yes, interesting. It's also the way ozone works is it will also kill senile human cells, because senile human cells, like older human cells, don't have enough cell wall protection.
Interesting.
They will take care of that as well. So it's very it's almost so intuitive, right? It'll only keep what the body needs.
Yeah, no, that's very, very true. I mean, anybody interested in ozone and dentistry, I mean, this is honestly, people need to be looking for a dentist who offers ozone, because you're going to have better outcome. Everybody wants a healthy mouth. Everybody wants that mouth-gut connection to be, good. There's so many chronic diseases out there nowadays. Like, we've got to do a better job keeping our bodies healthy, making sure we're, in the right place. And like, don't just go to the dentist saying, oh, my tooth hurts. Oh, root canal. Oh, titanium implant. Oh, this. I mean, we're not doing ourselves any benefit. Like, there's more to our body than just the whole cut and scrape model of dentistry where you're just going to pull and, repair. I mean, there's a lot more to it than that, and we have to be open-minded, I believe.
Right, definitely. And there's a lot of for people who are open-minded but still don't know and are seeking for information. IAOMT and IABDM are good sites. There's a lot of information, research work, links posted that you can do your research, because in today's time and age, when there's so much of information, like, ignorance is really a choice.
Oh, yeah, I totally understand. There's a lot of information to wade through, but finding a good dentist is the key. The sites that you mentioned, the IAOMT, the IABDM, those are great organizations to do research on. There's a lot of phenomenal dentists that you can find if you're in a specific area that need to look for a dentist that offers ozone. Definitely go to those sites. They're a phenomenal resource. But yeah, this has been a very informative to talk about ozone in dentistry and what else there is in dentistry that people are probably unaware of. So it's really, really cool.
Awesome.
Well, hey, I know we wanted to, keep it, we want to obviously, get a lot of information across, and you've done phenomenal, and you've answered all my questions. And again, thank you so much. Give us a little bit of information about your clinic and where people can find you, if you don't mind.
Sure. So my practice is located in Flower Mound in Dallas. It's one of the suburbs more on the north side, and in Tennessee. And we offer most of the holistic and airway services. We also take care of babies who need tongue ties. We'll look at airway early on in life and things like that. My website is Texas, spelled TEXAS, TexasHolisticDentist.com. And there's a lot of information, and we'd be happy to help anyone.
I was on your website, and you do have a great blog. You have a lot of phenomenal information. And when we do have more time to talk, I would love to discuss more of the airway stuff, because I've been diving into that as well. And that is really, really, really cool. So that might be a whole nother chat that we do about airways and how that can benefit people, with so many other things in life. So very, very cool. And I really appreciate the time that you've given us today. And again, thanks for watching this podcast, and message us if you have any questions. I'd be happy to, get whatever questions answered if needed. Thank you so much. Okay.
Okay, thank you. Have a nice day.
You.